Good evening, everybody. This is Dr. Kurt Woeller. I appreciate you joining me this evening for this particular topic on adrenal hormone imbalance and multiple sclerosis. I've done a series of these presentations. As you know, these presentations are about 30 minutes long, so we try to keep the information pretty concise. We're not going too long, but it's packed full of information, and I hope that you find this presentation helpful. Just to start things here, I have created a tremendous amount of online information. This is my official sort of main website, if you will, drwoeller.com. I've got general information about my practice, articles, links to other websites that host videos, etc. So if there's information you want to get about me, this is a good place to go at drwoeller.com. Also, I contribute information to a wonderful website called msrelief.com. This is a comprehensive information website with respects to MS, including things from lifestyle factors to medical information to insights about personal choice, personal growth. Anything you need can be accessed through msrelief.com. So check that out. And I also contribute videos as well as articles to msrelief.com. And then finally, I have been involved in patient education and patient-physician access for questions related to health concerns for many years. We launched this website a number of months ago called AskTheDoctor-ms.com. It's modeled after a very successful website that I have with respects to autism, where parents can actually ask me questions related to biomedical intervention for autism. This website is much the same thing, where you as an individual with MS, or if you are an individual who has a loved one with MS and would just like to ask me questions about my experience with MS or other ways of viewing things, this is a great place to do it. So AskTheDoctor-ms.com is a subscription website that you can join on a month-to-month basis and then post questions through an interactive forum. Okay, so let's go ahead and get started with this presentation. This is the overview. What we're going to talk about tonight is I'm just going to briefly explain the function of the adrenal glands and then make that connection to something called the hypothalamus pituitary adrenal axis. We'll talk a little bit about how chronic stress affects the adrenals, and then we'll talk about the importance of salivary adrenal testing over just even blood testing for adrenal function, and then how that is tied into some of the therapies and how this also can tie into some of the issues we see in MS. So adrenal gland function. So the adrenal glands are two small glands that actually sit on top of our kidneys. And we have a right adrenal gland and a left adrenal gland. And I apologize for this thing keep popping up. For some reason it's doing that because of the color slides. The adrenal gland is made in different parts. We have an outer part and an inner part. And essentially that's important because what happens when the adrenal gland is overstimulated from various chemicals, some of these rings or some of these areas of the adrenal glands can get a little bit big and the others can get a little bit small, and that can compromise what chemicals are actually being produced. When we're talking about the hormones related to adrenal function, we're specifically talking about what's being produced in the cortex, this outer section, if you will, of the adrenal gland. And there is a specific disease called Addisons Disease. Addisons Disease is when the adrenal gland, primarily the outer ring of the adrenal gland, starts to fail. It loses its function, and the output of cortisol is greatly compromised because of it. And people who have Addisons Disease will go into complete adrenal failure and have all different types of problems, neurological problems, cardiovascular issues, fatigue problems, psychiatric issues, etc. However, Addison's disease, as far as something that happens within the general medical community, is fairly rare. What isn't rare is that many people have what's called adrenal insufficiency, including people with MS. And I treated, individuals with MS, with chronic fatigue, with cancer, with, autoimmune disorders, with, you name it. And the vast majority of individuals with these chronic illnesses have adrenal insufficiency. What's interesting is that traditional medicine has viewed adrenal insufficiency for many years as sort of a false diagnosis or a vogue diagnosis that doesn't really carry any weight. But the reality is that it's been well known about in medicine for many years because the adrenal glands don't just all of a sudden stop functioning. There is a gradual decline in their function over time because of stress. And this was just a link that came out from the National Institutes of Health that actually talks specifically about adrenal insufficiency. And they talk about treatments for adrenal insufficiency, whether it's using pharmaceutical cortisone or what's called fludrocortisone to replace some of the other hormones. Even the traditional medical community can't deny that this exists because this is a document coming out from the government. Now, when we're talking about the adrenals, we have to take a broader scope and understand that its link, or I guess you say it has a relationship to the brain. The brain, in something called the hypothalamus, is a control center in the brain that is responding to various physiological stressors: heat, water, dehydration, salt, temperature, etc. And it's releasing chemicals to try to tell other areas in the brain to output signals to keep things in balance. And so we actually have a connection between the hypothalamus in the brain to the pituitary gland, which then talks to the adrenal gland. And we call this the HPA axis. The hypothalamus being that control center for most of the body's hormonal system. And the hypothalamus, when it needs to, releases a chemical called CRF. And this CRF chemical is released in response to most any type of physical or psychological stress. It doesn't really matter what the stress is. It sends the same signal to release this chemical. And as CRF is released, it then flows down and stimulates different areas in the pituitary gland to produce a chemical called ACTH. And it's the ACTH that actually then flows throughout the body and flows down into the adrenal glands to help stimulate the release of cortisol. And so this is just a picture here of where our hypothalamus sits, and this is a blown up image. And we can see there's areas in the hypothalamus that are related to water balance and stress, to hunger, to temperature regulation, to sleep cycle regulation. Anyway, but it talks to the pituitary gland, and it's in the pituitary gland where we're producing this chemical called ACTH. And so when the adrenal glands are then stimulated by ACTH, it produces cortisol. And the cortisol initiates a series of different effects throughout the body that essentially are to alleviate stress. Okay, so that could be controlling inflammation, decreasing pain, whatever it may be. Now, one of the things that's important from any type of autoimmune or inflammatory disorder is that cortisol is one of our body's natural anti-inflammatory chemicals. This is why prednisone, which is a very potent form of a steroid, helps to decrease inflammation. It's trying to mimic, in essence, or at least override sort of the minimal effect that cortisol. And so cortisol is having an anti-inflammatory effect, but it does other things too. What's important about cortisol function is how we test for it. Most doctors will end up testing blood levels for cortisol. Pretty standard. You go into the lab, they draw blood, and they look at a one-time morning cortisol level. The difficulty is that cortisol is actually produced in what's called a diurnal rhythm over a 24-hour period of time, which I'll show you here in some labs, which means that it cycles. It's not always the same level. Now, a blood test done in the morning can be a good way to just assess morning cortisol levels to see if they're low, but it doesn't tell you about what your cortisols are doing throughout the rest of the day. And so it's not what we call a functional test. It's a static test done at one time. And it can also be artificially elevated because just the stress of getting your blood drawn can sometimes elevate cortisol and not give you a true picture. And this is why salivary testing has become so popular. And it's very accurate because you're doing a sample collection in your home in real time, in the comfort of your own home. And you're spitting into a tube to get the sample. And you're doing it 4 times throughout the day to measure the different cortisols throughout the day. And it's much more functional, much more effective, and much more real as far as its physiological representation of what your body is doing. Now, from a medicine standpoint that has been used in MS, there is actually a medication called Acthar. And you'll notice here where it says ACTH. Now remember, ACTH is the chemical that's produced by the pituitary gland after it has been directed by the hypothalamus to produce this chemical, adrenal corticotropic hormone. And it's the ACTH that stimulates the adrenal glands to produce cortisol. Well, Acthar is essentially an intramuscular injection of ACTH to tell the adrenal gland to make more cortisol. And this is a treatment that has been used in MS and other autoimmune disorders, collagen diseases, rheumatoid arthritis, etc. So let's shift gears here a little bit and talk about the chronic stress response. And if you heard my presentation on thyroid dysfunction, some of these slides will seem similar to you. When we talk about stress, stress comes in many different forms. It's not just stressed out at being at work or stressed out because I've got a project that's due. It can come in many forms. Physical stress from injuries, mental emotional stress from fear, anxiety, worry, and these can be chronic in nature too. Chemical stress from toxicity that we're exposed to, vaccine reactions, toxic food, and just lifestyle factors in general. Okay, because the body doesn't really differentiate so much the different forms of stress. It's all just taking it in, the brain's taking it in, and then releasing chemicals in response to that stress. But I broke things down, from the standpoint of what is most common for most people. And really the #1 cause of what we call the imbalance of cortisol and the stress response is mental emotional. And there's nothing to cause more mental emotional stress than having some type of chronic illness. But a lot of people have mental emotional stress and aren't necessarily chronically ill, but they still can have adrenal problems because of it. And what's really important about this mental emotional stress component is it's not necessarily the stress event, it's our perception of that event. It's our perception of how we internalize it, of how that generates these chemical reactions. The second thing on the list that tends to cause, for most people, imbalances in cortisol through their adrenal glands is blood sugar problems. Just not eating a balanced diet, fats, carbohydrates, eating way too many simple carbohydrates, that causes a tremendous strain on our body and a tremendous strain on our adrenal glands to try to keep pace. So when we're looking at trying to deal with stress, no matter what your diagnosis is, mental, emotional, as well as dietary blood sugar are critically important. And then #3 I throw on the list here of just everything else. Okay, it could be food sensitivities, it could be infections, it could be injuries. I mean, there's a host of things. And so we know that within this category of illness, a lot of the chronic illness that we see in our society anymore is related to a chronic stress response. Diabetes, cardiovascular problems, autoimmune inflammatory issues, the list goes on and on and on. Okay, and so certainly we see it a lot in people with psychiatric illnesses. I see it certainly a lot in autistic kids, but patients with chronic fatigue syndrome, you know, multiple chemical sensitivity, they all have some imbalance in how their body is reacting to stress. So here's a graph of what happens through the progression of adrenal exhaustion. By the way, over here to the right where it says failure, that would be Addisons disease. This would be a complete shutdown of the adrenal glands, and if that happens, you are in a really, really serious place. That's not something that is real common. But we can have people, and often see people, who are existing in a state of what's called stage 2 or stage 3 adrenal exhaustion for many, many years. It's interesting that many individuals with MS actually are in a stage 1 where the adrenal glands are quite high, but not all the time. Often, if your adrenal glands are constantly stimulated because of various factors, over time what's going to happen is your cortisol levels will start to drop and you will move into a state of stage 2 and stage 3 where essentially your cortisol levels are low. Okay, this is a normal profile. Excuse me here. As you can see, we've got 4 different samples. We have a morning, a noon, an afternoon, and a nighttime. And as I mentioned before, when it comes to blood testing, most doctors will just do a morning cortisol level. And you'll notice that the morning level is the highest of the 4. So essentially our cortisols are highest in the morning, preparing our body for the daily activity, and then they diminish over time. And so we can graph this out. And this is why the salivary tests are so nice, because it gives us a snapshot of what's happening throughout the day. In many cases, individuals with MS sometimes can have elevated levels of cortisol, and that can cause problems as far as creating mineral imbalances in the body and whatnot. But this is just somebody here who has an elevated level in the morning. A lot of times when you see the elevated levels in the morning, it links back to some type of problem that they've had throughout the night. It could be poor blood sugar control, not sleeping, chronic pain, chronic infections, something that's stimulating the adrenal glands throughout the evening. Now, this is sort of a wrap-up slide of the things that we talked about before, in the fact that the brain interprets a stress response in much the same way, depending whether it's mental, emotional, lifestyle factors, factors from our environment, factors from what we eat, the things that we're exposed to through drugs and pharmaceuticals, etc. It all is going to create an imbalance through this production of this brain chemical called ACTH. Now, let's just go through this slide slowly here, and I'm not going to go through all of it, but to just kind of give you a little bit more of a graphic representation of what I'm talking about. Here on the left is various sources of stress. Okay, mental, emotional, physical, etc. When we're exposed to these, we send a signal, and HP is our hypothalamus. The hypothalamus will release that chemical that flows down to our adrenal glands, and we're going to output cortisol. Now, in an acute stressful event, we'll output cortisol. Cortisol will do its thing, control inflammation, turn this off, turn this on, and then everybody's happy, and it goes away. With chronic stress, what happens is this input into the system is continuous. It's like static. And after a while, that static causes chronically, consistently elevated levels of this ACTH, chronically elevated levels of cortisol, and over time, the brain gets numb. It's almost like it's not hearing it anymore. And so the signals keep coming in, it just keeps pumping it out, pumping it out, pumping it out, and it never shuts off. Over time, that creates problems because we start having a skewing effect of other hormones that are part of this network. And the bottom line is that chronically over time, it's what leads to the chronic illness that we see in our society. Whether it's the blood sugar problems of diabetes eventually leading to heart disease, whether it's the breakdown of bone, the accumulation of fat, the breakdown of muscle tissue, the breakdown of the nervous system, the breakdown of the immune system, which leads to all different kinds of problems, including autoimmune disorders. It all links back to this chronic stress problem. And one of the things that I've seen over the years, for some people with who have a diagnosis of MS, is that many times it was brought on shortly after some type of stressful event. I've had some people where it came on after an accident or a divorce or some type of, a bankruptcy, whatever it may have been. And it's not all the cases, but there's been enough that's led me to believe that that's at least a trigger for in some people. This chart is, again, a different way of looking at things. And this is interesting from not only the standpoint of cortisol, but also give you a little bit of an idea, particularly as we age in our hormone levels. You'll notice here cortisol right down on the lower left-hand side, okay? And you'll notice these things over here called DHEA and estrogen and testosterone and progesterone. So what happens is as we move through this pathway, we produce a chemical called pregnenolone. Now, pregnenolone can actually be replaced through supplementation. And pregnenolone, when everything is in balance, everybody gets their little piece of pregnenolone. Okay, so the DHEA gets its piece, the progesterone gets its piece, aldosterone gets its piece, etc. So everything's in balance. But when we are under chronic stress, we have what's called a preferential pathway. This is called pregnenolone steal. We're stealing pregnenolone to funnel it through cortisol so that cortisol can keep things in balance. For people who have hormonal imbalances, particularly women who have hormonal issues, as they age or cycle problems throughout their life, if you are under chronic stress, you can start to run deficits in estrogen and progesterone, creating cycle imbalances. Men certainly can run problems with testosterone, and so can women. Okay, so that's kind of what's happening here. The red arrow is essentially directing, telling you where things are going under the chronic stress response. Now, this links back to the presentation I'd given before about thyroid. And I won't touch on this too much, but the adrenals are also involved in thyroid. Okay, so many people have low thyroid function, and they assume it's just because their thyroid's the problem, but they don't understand that it could be their adrenals, because when the adrenals are stressed, cortisol will end up creating an imbalance in thyroid function. So a lot of times people end up becoming hypothyroid because of adrenal imbalances. This is a wrap-up slide. This is to give you sort of a global idea about the impact that the adrenals have in all of our body systems. And right in the center, the hub of the wheel here, you'll see cortisol and DHEA. Okay? And let me just back up real quickly, just to show you. Let me go right here. We have cortisol and we have DHEA, dihydroepiandrosterone. Okay? So think of those as sort of two sides of the equation. When we have an imbalance in that ratio, we will impact every single system in our body. We will impact our musculoskeletal system. We'll break down muscle. We have bone turnover leading to osteoporosis. We can affect our sugar metabolism, which affects our energy. We can mess with our anti-inflammatory system and end up creating more pro-inflammatory conditions. We impact our ability to detox from chemicals and things that we're exposed to environmentally. We mess with our hormones. I mentioned thyroid. We disturb neurological function. Okay? The connectivity in the brain and the nervous system can be impaired. We can impact our sleep, impact brain function cognitively overall. So the adrenals have an intimate relationship with respect to everything that's going on in our body. This is a profile of somebody who is in stage 3 adrenal insufficiency. Remember, there's only 4 stages. You've got stage 1, which is cortisol levels are high. Stage 2, where there's a transition. Some can be high, some low. Stage 3, where generally everything is low. And then failure, which would be Addisons disease. And you'll notice that all of the cortisols are low. And often I tell patients this all the time. In order for you to have gotten to a stage 3 adrenal problem, you had to have gone through the other stages. You had to have gone through a stage 1 and transitioned through a stage 2, unless there was some sort of massive injury to the adrenals that happened acutely, and that's not something that's real common. Okay? The reality is many people exist in a stage 3 pattern for years and years and years, including individuals with MS. Now, again, remember I mentioned before that some people with MS actually have elevated adrenals where their cortisols are real high. But if it goes on long enough, the levels will start to drop and you'll transition into these other areas. And one of the downsides to that is people who exist in a state of stage 2 and stage 3 adrenal insufficiency are oftentimes overwhelmingly fatigued. And I know that fatigue is a big problem in MS. I mean, it's one of those major issues that affects a significant amount of people, and is one of those things that causes a tremendous amount of disability. So the adrenal assessment, I feel, is critically important with respects to an overall medical protocol for anybody with a chronic illness, and particularly anybody with a diagnosis of MS. So there are various therapies that can be implemented. The nice thing is there's a lot of adrenal supplementation that can be done. And this is just an example of a few things that have helped some people, over time, as far as just general things that can help nutritionally. There are a number of wonderful herbal remedies that are supportive of adrenal function. Cordyceps, ashwagandha, Siberian ginseng. This is a particular product that has been used with many people. It's just a general herbal adrenal support. Safe, effective, well tolerated. Oftentimes incorporating general herbs and vitamins and minerals is also essential as well. Because the adrenals they're not living in isolation. I mean, they are part of our body. They need vitamins to thrive, vitamin C, B vitamins, etc. So it's not just about taking an adrenal supplement. It's about incorporating good diet, healthy diet, carbohydrates, fats, proteins, vitamins, minerals. So a really good program is to actually incorporate a number of different nutrients here for just good overall adrenal support. Now, there are different ways of replacing some of those cofactors, those nutrients, within the adrenal glands. A lot of people actually get benefit by taking what's called cortex glandulars, actually taking a product that actually comes from an animal that has those hormones in it within the cortex of the adrenal gland, so an adrenal cortex to help replace some of the deficiencies that may be existing. At other times, the individual cortisol needs to be replaced, and there's a product actually it's a plant-derived cortisol product called Isocort, which people get benefit from. And these can, there's a number of different sources online that sell these. I personally don't advocate people just taking Isocort without knowing where their adrenal levels are, where their cortisol levels are. Taking an adrenal product like a glandular or B vitamins or vitamin C, that's a little bit different, but trying to replace cortisol without knowing exactly where the cortisol level is not something that I recommend, and that's why the testing is important. There are additional supplements that are timed specifically to the individual cortisol levels of adrenal function. I mentioned before pregnenolone. Pregnenolone is one of those hormones in our body that's very important to keep balance hormonally. And there's a lot of ways of taking it, sublingually, sublingual tablets, and the dosage range varies. But on average, most people is taking something like pregnenolone for just general health support could be taking anywhere between 25 to 50 milligrams per day. DHEA is often quite low in people with chronic illness. I generally don't advocate just taking DHEA unless you have a test to tell you if the level is low. Some people, particularly women who've had a history of acne, sometimes taking DHEA can convert into testosterone and stimulate acne growth or production, which is not all that pleasant. It's usually a pretty well-tolerated supplement, but I liked data behind it before I would just arbitrarily have people taking it. B-complex vitamins, vitamin C, these types of things are all healthy and helpful for adrenal health. Sometimes we have to use medications. I'll commonly use a compounded form of cortisol called hydrocortisone. The reason I'll do it compounded, which means I can get it from a compounding pharmacy, a pharmacy that can make it in different potencies, is for that specific reason. So I can get it at different strengths and adjust it based on what the tests are telling me. There is a medication called Cortef, which is hydrocortisone, that's generally available from most standard pharmacies via a prescription. So traditional doctors can prescribe that, but again, they're going to be using that many times based on testing too. And then prednisone, which is a high-potency steroid, that's not something that I do, but I wanted you to understand that prednisone is a synthetic version of cortisol, whereas the hydrocortisone is essentially molecularly equivalent to the cortisol that our body produces. So often we're not really needing to use prednisone. If you have somebody with severe adrenal failure, then high-dose steroids are important. But from a functional health standpoint, if needed, just the hydrocortisones do just fine. And then to wrap things up here, what are some improvements that have been recognized and been seen with individuals through adrenal therapy? Many people feel more calm. Their sleep is improved, which I know is critically important with people with MS because that's often quite disturbed. Energy, less stress and tension, improved balance, improved stamina, decrease temperature, I guess I say decreased situations as far as heat and cold have been improved, decreased inflammation, swelling, etc. These are all common manifestations of improved adrenal function. So that's the presentation. I hope that was helpful for you. If you would like to interact with me more directly, then please do so. You're welcome to join the Ask the Doctor-MS site. I'm available. I answer questions throughout the day. You can go on here, post a question. There's access to other information too. Great place to reach me. There's no long-term contracts. It's something that you can join it month to month if you choose. So you can learn more about that at askthedoctor-ms.com. And with that, everybody, I appreciate you joining me tonight, and we will see you next time. Thank you.